Welcome to AKZI Study Hub, your everyday learning companion. Hey there, future nurses. Welcome to Fundamentals of Nursing. Unit 1, the nurse in the healthcare system. Imagine stepping into a world where you make a real difference in people's lives every day. That's nursing. By the end of this unit, you'll see how nurses fit into healthcare, from hospitals to communities. We'll define key terms like nurse and nursing, explore nursing's core philosophy. General objective. Students should demonstrate understanding of the nurse's role in healthcare settings. Specific objectives. Define nurse, nursing, nursing practice, and fundamentals of nursing. State the nursing philosophy. What is nursing? It's about helping people, whether they're sick or healthy, do the things they'd normally handle themselves if they could. Virginia Henderson said in 1966 that nursing assists individuals with activities for health, recovery, or a peaceful passing, helping them regain independence as quickly as possible. The American Nurses Association in 2003 adds that nursing protects and optimizes health, prevents illness, eases suffering by diagnosing human responses, and advocates for individuals, families, communities, and entire populations. A nurse is simply someone educated and qualified in this profession, as Anderson and Anderson described in 1995. Nursing practice is what you actually do, on your own or with the team. That could be independently feeding or bathing a patient, or working with others to give medications prescribed by a doctor. Fundamentals of Nursing is the course that builds your basic knowledge and skills so you can deliver comprehensive care and meet basic needs of people, families, and communities. We apply it at 4 levels: promoting health, preventing illness, restoring health, and rehabilitation. Every nursing action aims to achieve one or more of these. Now, let's shift to the philosophy of nursing, the guiding view that shapes the profession. Letty and Pepper in 2003 describe it as the outcome of nurses' efforts to understand the connections between humans, the environment, and health. At its heart, nursing philosophy honors each person's worth and dignity. Humans are central and treated as unique individuals. Nursing believes in caring, comforting, and helping people become healthy in body and mind, or adapt to disabilities when cure isn't possible. Everyone has potential to improve, depending on their motivation, willingness to change, and ability to adapt to treatment. From that philosophy flow the many roles nurses play. As a caregiver, you provide hands-on direct care, promoting comfort and recovery, and supporting independence while showing real concern for the whole person. As a change agent, you spark improvements in patients or in the health system, maybe by promoting cancer screening or family planning in your community. As a client advocate, you protect patients' rights, explain information from other professionals, and help make sure their needs are met while supporting their decisions. As a manager, you coordinate the team, allocate resources, plan, and evaluate care, so everything runs smoothly. You're also an educator, teaching skills, encouraging healthy habits, and translating complex information so patients feel empowered. As a counselor, you offer emotional support, help people handle stress, build relationships, and grow through new perspectives. Finally, as a researcher, you identify problems, join or lead studies, and apply findings so that nursing care keeps improving. These roles grow and evolve as your training and experience deepen. Next, how are health services organized? Think of it in 3 main levels. At the national level, the Ministry of Health oversees the whole system. Below that, the provincial level includes general hospitals serving around 200,000 to 800,000 people, offering specialties like ICU and pediatrics. At the district level, you find district hospitals, health centers, and health posts. Central or tertiary hospitals serve 800,000 people or more, providing advanced care like major surgery and mental health services. And they often handle training and research, like UTH in Lusaka or Kitwe Central. In communities, care is more local. Health centers and posts are the front line. Urban health centers usually serve 30,000 to 50,000 people, while rural centers might serve about 10,000. Many operate 24/7 and may have around 30 beds, handling diagnosis and treatment, maternal and child health, outreach, and prevention efforts such as distributing mosquito nets and working with community groups. Health posts cover smaller populations, about 3,500 rural or 1,000 urban households, often supported by community volunteers. Key community players include traditional birth attendants assisting deliveries, community health workers providing home care, referrals, and health education, distributors supplying items like condoms or chlorine, and neighborhood committees linking households to services, mobilizing projects, and tracking basic statistics. Finally, the multidisciplinary health team brings different experts together for the patient's best outcome. In hospitals, the patient is at the center, surrounded by nurses, doctors, pharmacists, therapists, social workers, dietitians, and laboratory staff. In communities, the team includes individuals and families, community health nurses, environmental health technicians, community committees, agents like CHWs and TBAs, as well as faith groups and NGOs. In all these settings, nurses connect the pieces, bringing their roles as caregivers, advocates, managers, educators, counselors, and researchers into everyday practice. There you have it, the foundations of nursing in action. Thanks for joining, and let's keep working together to make healthcare better for everyone.